Hi, my name is Claudia Shapiro. I am a licensed clinical social worker with a private practice where I work as a therapist for children, adolescents, parents, families, and I also work with teachers and to support social emotional issues. I also have my own severe food allergy that I have had my whole life, and so talking about coping with the psychological effects of managing food allergies is something that I'm really excited to be doing today. So, just a quick run through that there is a lot of great research out there that does show that having a food allergy or raising a child with a food allergy does significantly affect the quality of life. You're probably not having life threatening allergic reactions on a daily basis, but it's very likely that you are feeling anxious, afraid, worrying about having allergic reactions, or worrying how to navigate social situations because of your food allergy on a daily basis. So, this is a real part of having a food allergy. And I really think of it as kind of a trauma response that your brain, when there's an allergen present, sends off all the alarm bells and you have to go into like protection mode, crisis management mode. And so today I really want to talk about ways to calm yourself down in those moments and to just feel better overall, dealing with both the emotional impact and the social impact of having a food allergy. So, starting off, I'll just run through these quick coping strategies for caregivers. I will say that if you're the caregiver of somebody with a severe food allergy and you have your own history of anxiety, depression, or another mental illness, or you're just struggling with a lot of other challenging emotions at this time, I would not hesitate to seek your own therapy to cope with all of this. Like I said, it is a real part of having a food allergy that is like affecting everybody daily, and so it's not a problem to ask for help. Research has also shown that having more education will lead to more confidence in managing a child with a food allergy and less anxiety overall. So it is really important to get lots of information from valid, reliable sources and to feel more in control of yourself and your child. Again, validating your feelings is really important, and you can use all of that wonderful research to show that this is a real problem. This is something to be taken seriously, and especially in situations where somebody may accuse you of overreacting or making too big of a deal of it, it's easy to get down on yourself and feel worse. But know that this is real. This is valid. It is very valid to be anxious, to be afraid of having a food allergy and all that comes with that. It's also valid to feel frustrated that you have extra responsibility or frustrated that family members or friends don't fully understand. It's all valid. And so reminding yourself, your partner, your children that this makes sense, your feelings are valid, and we can find healthy ways to cope with them. Positive reframing is another strategy that is really helpful. Like I said earlier, having some anxiety is protective. If you're worried about having an allergic reaction, you're going to be more conscious and take the steps that your physician will recommend. And so it is a strength. It is something, it is not all bad. You can think of it as a protective thing too. Mindfulness is always a great tip, whether it's meditation, deep breathing, visualization. There are lots of great apps out there, and mindfulness is something that really, really helps our brains coping with trauma responses. And so when the alarm bells go off, once you kind of evaluate whether or not this is an emergency crisis mode or your brain is keeping you safe but maybe just a little too anxious for what the situation is calling for, that's when you can really take some deep breaths, calm your body and your mind, and really try to get back to what is in the present. Our brains are just trying to keep us safe, so a lot of time they sound the alarm when it is not a life or death situation, And so to be able to recognize that and then also calm yourself down and recognizing your triggers, recognizing when you get very anxious, when you start to get heightened or your thoughts are moving really rapidly, you're kind of going down that spiral of worst case scenario. Again, stopping, taking the deep breaths, and modeling all of these skills for your child. The more that you're taking care of yourself and keeping yourself calm enough to care and protect your child, the easier it will be for them as well. So when it comes to children, some of the coping strategies that are really helpful, again, education. At different ages, this is going to be different. Younger children will need to know the basics. Older children will start to have a lot more independence and responsibility and will need to learn different skills and strategies. But education is always a useful tool. Also, labeling and validating feelings. So to say to your child, you seem really scared to eat this, that makes total sense. You don't have to. I brought a snack that we know is safe or whatever. But being able to label the feelings, because children are also learning feelings at the same time that they're learning to avoid certain foods. So being sure to label the feelings and then validate them, that this is normal. It makes total sense. It's not weird. It's not overreacting. Mindfulness for children, another huge skill. And then, of course, playing. So Gary Landreth says that play is the child's language. And so when children are figuring out complicated things, trying to make sense, trying to learn, they play. That's, why we play house. You pretend cook as a child with your little kitchen set. It's all to make sense of the world and these concepts that you are being introduced to but don't yet quite have a handle on. So it can be really helpful to just allow your child to have their non-directive playtime. You let them lead and you follow their lead. But you can also sneak in some ways to act out some of the challenges they may be dealing with their food allergy. A lot of people have toy doctor's kits, and especially if you're somebody whose child has spent a lot of time at doctor's visits, I think this is a great thing to have for them to play with. And if you carry an EpiPen or your child carries an EpiPen, they usually come with a trainer, and putting the EpiPen trainer into your toy doctor's kit gives them that extra push and availability to play with that, act it out, practice, and not just in serious kind of conversations with their parent practice mode, but as they're playing. They may play that their stuffed animal eats something they're allergic to, and what do? They have to use their EpiPen, they have to go to the hospital. It's a way for them to make sense of it. Also, playing with play food and kitchen. If you're playing with your child and you're pretending to be in a restaurant, you may, when you place your order, say, oh, and I'm allergic to whatever. Just kind of normalizing this through the play. Art is a great way to express emotions and to make sense of them. Drawing pictures of how they're feeling, or even drawing pictures and writing a book together, a story of kind of your food allergy. Or if you had a big event where somebody ate something they were allergic to, had to go to the emergency room, your child could draw pictures and narrate for you, and you could write that book together, write that story, and then you can read that book together, retell that story, and make sense of it. Role plays are crucial, and I could go on forever about role plays. It's just a great way to practice difficult situations in kind of a low threatening way. So all of the strategies that you want your child to be utilizing in their day-to-day lives, you want to be practicing. And one of my favorite tools is using puppets, and I think puppets are a great way to make it fun, especially for younger kids. It's a lot more engaging, and it just feels more fun and sometimes even easier to have these difficult conversations or practice these difficult conversations with a puppet as opposed to a real adult. And of course, these will change based on your developmental stages. So take into consideration what your child is going to be having to navigate and what would make the most sense for them to practice with you. For teenagers, again, a lot of this looks the same. Education is important, and there are new issues that come up with being a teenager. Um, as a teenager, the worst thing you could be is different. And so if you have a food allergy and your friends don't, you're the only one with an EpiPen, you're the only one having to tell a waiter or waitress that you have food allergies. That can be devastating for a teenager. And so really validating that that is normal and practicing how to deal with it. Dating and kissing can also come up for teenagers. Again, these may be like the most awkward conversations for teenagers to have with their parents, but I think opening the door is important. Finding outside therapist or somebody else if it would be helpful. Even using puppets to just kind of rip the Band-Aid off. Yeah, this is awkward. I know you're way too old for puppets, but I'm going to be silly. Let's just try to make this as fun as we can. Another thing for teenagers is, again, I don't condone underage drinking, but it occasionally happens as kids get closer to legal drinking age to talk about the concerns that alcohol present. The craft beers are super popular these days, and they don't have ingredients on it. And so it's important to have those conversations. Also, just coming up with some lines, a script that you can say, foolproof, like get out of jail lines to use in difficult situations. One of mine, when I'm at like a wedding or an event and people are maybe a little more pushy or say, oh, I don't know, that I can't confirm that there's nothing in it, but I'm sure it would be fine. One of my go-tos is like, that's okay. I'm really not trying to be the center of attention right now, or I'm not trying to steal the show right now. I like using humor. It's easy. It kind of diffuses the awkwardness, but it's still a good way to say what I need to say. Get out of, feeling pressured to eat something that I'm not comfortable eating. Another one I frequently say is I love eating, and I'm just not going to enjoy it if I have even a smidge of doubt that I might have an allergic reaction. And so coming up with lines that feel kind of natural and would be easy to deliver in a high-stress time. For teenagers, it might even be helpful to kind of pre-write and have saved on their phone text messages to send. So if you get invited to an event, a little pre-written, hey, heads up, I have a food allergy. Let me know what the food situation is so I can eat before if I need to. These are all things that are really hard to do as teenagers and adults, and so practicing can really help it be easier. Again, mindfulness, and I mentioned role plays. It's awkward, it's uncomfortable, but kind of embrace it and just do your best. Finally, like the more tips for everybody, I practice. Support groups can be really helpful, and referring to outpatient therapy if it's really getting in the way of a lot of life. And then self-compassion. This is hard. It is hard, but that's why we're here, and just you're doing the best you can. So try to remind yourself of that as well. Setting limits. Where you're comfortable, where are you not comfortable, and don't budge on that. If you just don't feel comfortable going to a baseball game because there are peanuts all over, then don't go if you're going to have a miserable time. It's just really like giving yourself the permission to say, this is too much for me and it's not for me. But then also finding the times when you can make accommodations and make it a little bit easier for yourself. Finally, more research. That's why we're here, and there's a lot more that we can learn and study to really support our food allergic families and communities. So again, I'm thrilled to be here. I'm really looking forward to answering questions, and thank you so much.
Hi, good afternoon. My name is Dr. Linda Herbert, and I'm a psychologist at Children's National Hospital in Washington, D.C. And I'm excited to be part of the Living TO Global Summit presented by FAIR this year. It's been a really important part of my career to be involved with FAIR and previous team summits. So I'm really excited that I'm able to be with you here again today. Today, I've been asked to talk with you a little bit about mental health treatment experiences among patients with food allergy and their caregivers. So let's dive right in to learning a little bit more about what it is that you as patients have told us about your experiences with mental health and food allergy. As a brief bit of background information, we know that food allergy patients and caregivers of children with food allergy experience decreased quality of life and increased anxiety as a result of the daily demands of food allergy management. And in particular, this is about the fear of accidental allergen exposure and the need to treat an allergic reaction. This research is really based on decades now of studies that have been conducted with families like yours, in which you've told us how is it that you feel your quality of life is affected? How is it that you feel that you have stress in your life related to food allergy? And we're really appreciative that all of this information has allowed us to develop really important research questions. One of the things that we've noted as we have conducted this research and found that there's been an impact on quality of life and overall mental health is that access to mental health services to address these psychosocial concerns really can be crucial in supporting families in successful food allergy management. When you work with a mental health professional, many times what they will try to do with you is achieve what is called balanced integration of food allergy into everyday life. And so that is finding a balance of using food allergy management techniques that allow you and your child to be safe, while also doing all of the things that are appropriate for you to do and for your child to do from a developmental perspective. So attending family gatherings, attending school, being included in parties and activities at school that might involve food, such as art classes, sitting in the same cafeteria as other kids that have food allergies and being integrated and included in that way. However, knowing that mental health support is helpful for families is one thing, but actually knowing how much mental health support families are getting is another. And so a recent study by our team at FAIR as part of an outcomes research advisory board found that most food allergy clinics in the United States do not actually include mental health professionals. And this slide right here is showing you a little bit of what we found. When we asked 29 of FAIR's centers of clinical excellence whether or not they had psychologists, psychiatrists, or social works or a master's level equivalent in their clinics, we found that only 3 had a psychologist, only 1 had a psychiatrist, and only 2 had a social work or master's level professional. And when we dive down into the institution and community level, we found that there's also very inconsistent availability of mental health professionals with food allergy expertise to which our allergy providers have been able to refer patients. So this told us that from a provider perspective, it can be very hard to provide mental health referrals to our families. However, what we didn't know when we conducted this study was what exactly the experiences were of families themselves with accessing food allergy related mental health treatment. So this project that I'm telling you about right now was directly informed and was assessing you all, anyone who participated in the Food Allergy Research and Education Patient Registry. So as some of you might know, and as others are learning a lot at this summit, FAIR has an IRB approved online patient registry where patients are able to log on to answer questions about their food allergy history and their experiences. And in December 2018, FAIR posted a food allergy related mental health questionnaire that my colleagues and I developed that specifically is addressing participation in mental health treatment for food allergy and subsequently what those experiences with mental health treatment have been like. We assessed this information after collecting data for about a year and looked at some descriptive statistics and frequencies. So we're looking at means and percentages to understand what the experiences were like for patients and caregivers. This table is giving you an overview of the participants who were included in this project. So you'll see that we had two categories that were included. We had about 300 patients, and then we also had over 300 caregivers of children that had food allergy. The mean age of our patients was 40, and of the children of our caregivers who were included was 9. And the majority of these were female patients, but there was about a mix of males and female children. Many families reported that they were Caucasian, and many families reported that they had private insurance. This bar graph is showing you some of the results that we had from this project. And throughout these different bar graphs that you'll see, you'll note that the teal bar is patients and the yellow bar is caregivers of patients. So when we asked if someone had food allergy related mental health concerns, we found that of these 300 patients and 320 caregivers, 71% of the patients said, yes, we have had food allergy related mental health concerns. And a comparable number, 61% of caregivers said that they had as well. We also asked whether or not these carry over to non-food allergy related mental health concerns. And as you can see here, many said, yes, it did. So 50% of patients and 27% of caregivers said that this had an impact beyond just food allergy. We also asked whether or not these families had ever been diagnosed with a mental health disorder. And here we see that almost 50% of the patients said yes, at some point they had, and that about 15% of the caregivers said that this was true as well. When we asked about common food allergy related mental health concerns, you can see a pretty broad array, but many things that are focusing on anxiety. So among our patients, the most commonly reported mental health concern was general allergy anxiety. And after that, we find that anxiety after an allergic reaction was something that was concerning. We also saw that there were concerns regarding safe food avoidance, as well as social isolation and adherence to food allergy regimens. Among caregivers, in addition to these other things of general anxiety, anxiety after an allergic reaction, social isolation, we also found that many reported that they had concerns regarding trusting others with the care of their child with food allergy. And many families, where you can see 42% of caregivers said that they had stress about their child's health. We also asked families to tell us whether or not they had ever attended a mental health appointment specifically due to food allergy. And we found that 23% of patients said yes. 27% of caregivers said yes, they had gone to an appointment for themselves related to food allergy. And 21% of caregivers said that they had attended a mental health appointment for food allergy for their child. So here we can see that about 1 in 4 to 1 in 5 families who responded on the patient registry said, yes, we have gone to an appointment. And that's a staggering number when you consider how many patients are diagnosed with food allergy. What this chart is showing you is the different types of settings in which mental health treatment was sought. And what we find by and large is that families are going to private practice settings to seek mental health services for food allergy. There are some who are going to community centers, to outpatient therapy practices like an academic medical institution, and some that are also seeking care within a school setting. We also asked about the number of treatment sessions that participants attended. And here we see that there is, again, some variety, with some families attending just 1, some attending 2 to 5, some 5 to 10. But really over half of the patients that we surveyed and half of the caregivers said that they had attended at least 10 treatment sessions. And so if we break that down into a typical therapy schedule of one session a week, that's at least 2 to 3 months of consistent treatment sessions. Sometimes it's common for therapy to be either biweekly or monthly as well. And if we extrapolate 10 sessions over biweekly or bi-monthly sessions, then you also are getting folks who are consistently being seen for therapy in a ballpark of 6 months to a year. As we delve a little bit more into mental health treatment experiences, we asked about whether or not the mental health professional was collaborating with an allergist or a pediatrician about food allergy, and whether or not they were knowledgeable about food allergy and helpful for specifically addressing food allergy concerns. We found that not very many patients and caregivers said that the mental health professional was collaborating with an allergist or food allergy related provider. However, about half of them said the mental health provider was knowledgeable about food allergy, and many of them felt that the mental health professional was very helpful in addressing their food allergy concerns. So that is wonderful. You know, we're finding that patients are saying that this has helped them, that they've been able to get some treatment. But I think drawing our attention to the fact that not very many mental health providers are knowledgeable at food allergy is an area that really sticks out to me as something that that we in the allergy community can be working on. When we break down satisfaction with mental health a little bit more, we asked on a 5-point scale how satisfied the patient or the caregiver was with their mental health experience. And what we see here is that almost half of patients and caregivers were very satisfied with their mental health treatment experiences. But it's also notable that about 23% of these respondents did seek a second mental health provider due to initial satisfaction. And so we don't know exactly why that was. Perhaps it's because it wasn't a great match. Perhaps it was because they didn't know much about food allergy and didn't feel that that was helping them, so they sought out a second person. But it's notable that folks are having to seek out more than one person at times. And then importantly, we also asked about common barriers to seeking mental health care. And families were able to select from a checklist all the things that applied to them, but they could also write things in as well. And what we heard from both patients as well as caregivers of children with food allergy is that the cost of mental health treatment was a barrier. We also found that finding childcare for the allergic child was a barrier. And my hope is that now with telehealth being much more available, that might be less of a concern. Lack of insurance coverage was also something else, or the not having a practitioner available in the participant's geographic area. Again, I'm hoping that things like telehealth might be able to address that. And then also time constraints. So there's a variety of things going on that we need to be delving a bit more into to see how it is that we can help families address these barriers in the event that they're wanting care but not able to get it. So to conclude, we found by using the patient registry that about 1 in 5 respondents had participated in mental health treatment for food allergy related concerns at some point. We found that about half of them found that a mental health professional with food allergy knowledge was available, and many said that treatment was helpful. We also found that collaboration with medical professionals was rare, and some folks sought a second mental health professional, and that logistical barriers were noted. So when we think about where we go from here, it's wonderful that we have this data from the FAIR patient registry. We want to continue to collect these data, but it's equally important for us to start seeking out this information among a very diverse sample beyond the patient registry as well, so that we can understand how it is that we can make access to mental health services more equitable across a racially diverse and a broad socioeconomic spectrum. So I hope that provided some insight for you about the type of research that's being done on the patient registry, as well as what we're finding are the experiences of our patients regarding mental health treatment. So thank you so much to all the patients and caregivers who participated in the FAIR patient registry. Some of you may have completed these surveys if you're listening today, and for that, I thank you. And then I had 3 very important collaborators on this project. Louis Garcia and Mary Jane Marchisoto and Dr. Brian Vickery. So thank you to everyone, and I hope that you have a wonderful remainder of your Living Teal Global Summit. Thank you.